Do12 is on the posterior midline, below the spinous process of T3.
Do16 is located on the posterior midline at the base of the occiput. To find the base of the occiput, palpate down to about 1 cm superior to the posterior hairline. If you rock the head backwards and forwards very gently, you should be able to feel the cleft between the base of the occiput and the spine. Make sure you mark this point directly on the posterior midline. Do20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do20 is located 1 cm posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other dew points, so don't be tempted to go further back than 1 cm posterior to that midpoint. To locate gallbladder 20, palpate up the groove in between the sternocleidomastoid and trapezius muscles. As you get to the base of the occiput, you will find a nice depression. Gallbladder 20 is in the centre of that depression. Bladder 8 is located 5.5 cm into the anterior hairline, 1.5 cm lateral to the midline. The easiest way to find bladder 8 is to find bladder 7 and then move posteriorly by 1.5 cm.
Pericardium 4 is on the flexor aspect of the forearm, on a line connecting pericardium 7 with pericardium 3. It's 5 cm proximal to pericardium 7. In between these two tendons, palmaris longus and flexor carpi radialis. As you get to this point, the tendons start to go deeper within the body, so maybe a little bit more difficult to palpate, but remember you're going on a line from pericardium 7 to pericardium 3 to help you. Pericardium 5 is on the flexor aspect of the forearm. It's 3 cm proximal to pericardium 7, in between the two tendons of palmaris longus and flexor carpi radialis. Pericardium 7 is on the flexor aspect of the wrist. It's level with heart 7 and between two tendons, palmaris longus and flexor carpi radialis. Some people don't have this palmaris longus tendon, in which case you'd just be going ulnar to this flexor carpi radialis. So finding heart 7, articulate the wrist, coming between those two tendons, that if you can't see them, you can get the person to join their thumb and their little finger together, and that will highlight those two tendons. And just relax again. Small intestine 7 is 5 cm proximal from small intestine 5 on a line connecting small intestine 5 to small intestine 8. Running my finger down between the anterior border of the ulna and flexor carpal ulnaris. Large intestine 13 is 3 cm superior to large intestine 11. It's between the lateral borders of biceps brachii and the shaft of the humerus. If you divide the distance between the anterior axillary fold and large intestine 11 into thirds, the point just lies there.
Gallbladder 37 is located 5 cm superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're finding it difficult palpating the anterior border of the fibula, raise the patient's leg very slightly so that the flesh can drop away from the bone. This should make it easy to find your point. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella.